This is a case that has a lot of value because there are many moving parts to it. We see somebody who has a long face with an imbalance in the lower facial third particularly. They have a facial asymmetry at really every level, the upper jaw, the lower jaw, and the chin, with a leftward deviation of the chin and of the lower jaw. They have what's called a cant, where their upper jaw is slanted, and they have a midline discrepancy where their upper front teeth are shifted to the opposite side, to his right side. Additionally, there is a mismatch between the soft tissue envelope and the bone structure. The lips can't meet at rest, and you have a condition called labial incompetence. So what we have to do in a case like this is to restructure the face and to create a proportion that looks more like this. We'll get some nasal tip elevation from repositioning the upper jaw. We'll get better support of the cheeks and the upper lip, reduce the chin height, and we can get him to a result that looks like this. So this was our goal. At the skeletal level, we're trying to restructure his upper jaw. So we're going to section into 3 pieces, and that's going to allow us to level, widen, and center of his upper jaw. On the lower jaw, his right jawline needs to swing out, and his left jawline needs to swing in and down. We also need to create a more balanced symmetrical notch on his right side to match the one on his left side. And then lastly, we have to center his chin, and we need to decrease the height of his chin. And then on the left side, we did a modified cut that we published called the HSSO, and you can see how the cut goes straight back above the angle of the mandible, and that allows us to swing down and in. This is a facial analysis showing us the symmetry correction. This is where we got, and you can see the changes in the nasal tip. You can see how the upper lip is now supported, the cheeks are more supported, the upper and lower lip meet passively at rest. The chin now has a proper labial mental fold, decreased height, and the overall profile is just much more balanced. So you can see the improvements of the symmetry of the gonial angles. The chin is now lined up with the center of his face, and when he smiles, the upper teeth are now coincident with his facial midline, and the cant is corrected. Overall symmetry is very good. I love this case for a few reasons. We're not just fixing a bite, it's managing the soft tissue. When you place the jaws together, how is the soft tissue going to respond? Because at the end of the day, that's what people see. They see the skin on the face. They're not looking at your bone structure, they're not looking at your CAT scan. So for a case like this, where in many ways it's a reduction of facial skeleton, in order to avoid soft tissue laxity or poor soft tissue support, we had to then expand or volumize the facial skeleton, but in different directions. So we gave up some things in a vertical dimension, but we recaptured it in an anterior dimension. So a really cool case. I hope you guys enjoyed it.